Welcome back to FATV News Today. GMO, genetically modified organisms, if you like. A lot of people don't quite know what it is in Nigeria, but recently it's been in the news. NAFDAC is talking. Everybody, concerned stakeholders, are wondering how Nigerians will end up when what's on their menu, the food they eat and their well-being, if they start consuming genetically modified foods. What is it about? There are a few gray areas that need to be straightened out. So what are the things that Nigerians are supposed to be asking? What are the questions? And what answers should Nigerians expect when they have these posers as to how GMOs can affect our lives? And to help us put some of this into perspective, I am joined by my guests this afternoon on the program, Dr. Adebayo. Dr. Adebayo is, of course, has been moving around the country, submitting perspectives on this. Dr. Segun Adebayo is the Executive Director, Center for Africa Policy Research and Advisory. He's also the Deputy Director, Center for Food Safety and Agricultural Research. Thank you, Dr. Adebayo, for joining us this afternoon on the news.
Thank you for having me. Good afternoon.
So, I mean, first of all, for someone who's just joining this program, what's GMO? Let's start the conversation like that. There's someone who's just hearing GMO for the first time. And just to set the conversation rolling, what is GMO?
So GMOs are genetically modified organisms, could be plants or animals that have been modified at genome level. In other words, in the genes of that of that organism, the genes have been tampered with, by scientists. And there are two types. There are two types of, this is very broadly speaking, There is the one where you just open the genome and then you have some removals and you just tamper with it. But the one we're talking about here is where genes are introduced from another organism, another species entirely. So you're looking at genes being taken from maybe a dog and being put in a fish because you want the fish to start barking, or you want the tomatoes to have the look of a fish. So you take maybe the genes from a fish and you put it in a tomato. So what you're doing is you are actually exporting genes across the species barrier. And that's when you see the word transgenic. That means that genes are transferred across species barrier. And this is where we get very concerned, because nature in itself does not permit such transgenic movements. It's not natural. It doesn't happen naturally in nature. So when scientists begin taking genes across the species barrier, we raise a lot of, we begin to have ethical concerns. We begin to look at how safe are these things, what are the implications, and then you begin to ask for what assessment has been done to ascertain the safety of these kind of processes. And that's why it's currently a big conversation in Nigeria, and interestingly, not just Nigeria. It's been a big conversation in many parts of the world, in India, in Brazil, in Netherlands, in the UK, all around the world. GMOs have been a big conversation. GMOs and glyphosate, which is an addendum chemical that always goes with the GM product. So it's been a big conversation, and I dare to say that Nigeria joined this conversation very late. Many parts of the world have been talking, There's been huge debates beginning from the early 2000s, middle 2000s, even down till now, that it's been a big conversation, and Nigeria joined this conversation very late. So the concerns are valid, especially when we are currently interrogating the source of many diseases that we have in the world today. Science has not successfully told us where cancer is coming from. where many modern illnesses are coming from. Children are going down with all sorts of diseases today. So it's just important for everybody to start asking questions. What is really going on with our food? What's going on with our health? Because your food is your medicine, and
That's
it's
right.
just in order. Thank you.
Yeah, I mean, I like the fact that you've mentioned that food and our health. And we have NAFDAC, and NAFDAC has been making statements because I was reading through your posts on X. So NAFDAC says it is not good in 2024. And in 2025, NAFDAC says GMOs are fine. So, I mean, because you are also intervening on that, how do you see that sudden change of perspective from NAFDAC?
I think it's worrisome because the NAFDAC Director General this is an office that holds historical importance in Nigeria, considering the very popular Dr. Dora Akinloye, who became well celebrated in Nigeria, very beloved amongst Nigerians. And you can see her name popping up in today's conversation. People are saying they miss her today because they know that she stood and protected Nigerians when Nigerians needed her the most. So today we have a very interesting development. In 2024, last year, I personally watched that interview when it held, and the Director General of NAFDAC came up and said on national TV that GMOs were not safe for human consumption. And she said that the reason behind that statement was that there was insufficient data to prove that it was safe for human consumption. And I think that this is where Nigerians should now start studying. Because I have always said that Nigerians need to study. And immediately after that statement, it was followed up by a warning from the DG of NBMA, which is very public. All the records are out there. You will see the news article, the NBMA cautions NAFDAC on that statement, which they said was a misguided statement. And it's almost like the two government agencies are taking two opposing positions on a particular conversation, and leading to the then Minister of State for Health, Dr. Tunji Alausa, brokering a meeting between both organizations, to try to bring peace, which the NAFDAC DG rightly said that there was an MOU signed between them for them to work together very closely. So yes, last year, she actually said GMOs were not safe. And this year, she comes to say GMOs are safe. And Nigerians are concerned that how do you flip-flop that much within a year? What record, what data do you have to tender to the science community that warrants such a drastic turnaround in science? Professor Mojisola holds a highly magnificent position in the science community at professorship level, and it's only befitting for her to now, maybe release a paper or a journal or something on what data she consulted that or conducted or researched to warrant such a drastic turnaround. Because even till now, there is no known long-term risk assessment, to ascertain the safety of human beings consuming GMOs. There is none. Of course, the World Health Organization has, they have a couple of reference materials that they used to say that, they have some 28-year study to prove that it's nothing really happened and all, that it's okay, but that's not long enough. What we have in Nigeria was the NBMA said they used the European Food Safety Authority protocol, which is just a 90 days trial for GMO. And that's not sufficient. It's insufficient for you to determine that this thing is safe for human consumption. And, in a sovereign state like Nigeria and like any other country, which is what this is the argument many countries are bringing up, their indigenous science communities need to conduct their own science to prove that this thing is needed. So we're asking NAFDAC, what research has NAFDAC done to come out boldly to say to Nigerians that this thing is safe for human consumption? Yes, she actually said again that it must be labeled. But currently we have a food system that, I mean, how do you go to a fast food and you actually see that they use GMOs to produce the moi moi or the food? It's impossible. So at the impossibility of GMO being labeled, why are we allowing it in the country? Why did you allow it in the first place? If you look at the report from the NBMA DG and NAFDAC DG, they are talking about coming together to look at how it can be labeled. You shouldn't be talking about that now. That's medicine after death. The thing is already out there. You may have eaten GMO this morning, you're not aware. That means your choice has been taken away from you. So why would we take such hovering decision on a nation, on the people in a nation, without giving them the right to choose exactly what they want? And that's the reason why the conversation is raging at the moment.
Yeah, you're very, very correct. But Nigeria is a very peculiar setting. And to talk about this, people can carry things from across our borders. People can move seeds across the borders and start planting them without anybody asking them questions. And when those seeds start fruiting, they introduce these things into the market unregulated. Are you worried about how porous our borders are? I mean, even if the NBMA and the other institutions are trying to actually put something in place for checks, are you also worried about what people do unregulated in this space, bringing in all sorts of species of plants and even animals into our space?
It's a big worry, because when you look at Nigeria's, I mean, the Chief of Defense Staff said very recently that we need to build a wall around the country to secure our borders. I'm sure you are aware of that report. The Chief of Defense Staff said that we need to wall the entire nation, the nation. So for him to make that statement, that means our borders are just open. Anybody can stroll from Benin Republic into Nigeria, or stroll from it's just open. So it becomes worrisome. I mean, very worrisome. And that's why, I think that the conversation on biosafety needs to extend into biodefense. I mean, the same way we are concerned about weapons. I mean, there's a country that actually, when it was banning GMO, it actually put GMOs in the category of weapons. It said the banning GMOs and some other weapons. So if you are looking at strengthening your defense from weapons infiltrating through the borders, and you should also be very concerned about such seeds, because GMO seeds have a very interesting, they have a very interesting attributes which makes them very dangerous. If you have a GMO farm close to an organic farm of the same crop, maybe maize, you would find that the GMO farm will cross-pollinate with the natural one, and gradually you start losing your natural heirloom. And that's the reason why one of the reasons Mexico actually banned the GMOs. So you're looking at something that is potent enough to eliminate your natural variants. So in the case of, porous borders, that means something could just enter the country. We don't have good monitoring. We don't have good ways to really ascertain that these things are safe and are allowed. Yes, the NDMA is trying. They came up on TV and said they are collaborating with other government agencies, such as the customs, the civil defense, and the rest of them. But, I mean, at the moment, it will be very important that we carry out a research, a study, for us to know the amount of GMOs we have in this country. I am very certain that we have more than the approved that has been given to us on paper for cultivation.
I mean, it's worrying, isn't it? You've also talked about the lack of science or scientific approach in regulation and how people even view things around GMO. Are you very worried about the lack of adequate information out there within our space regarding GMO related activities? People don't seem to know what it is. The people just associate anything GMO as those fruits that are big. You know, that's just the elementary aspect of what people see. If you see a high yielding fruit, you are saying it's like it's GMO. I mean, but it's beyond that, isn't it? It's beyond that,
Yes,
isn't it? There is a lot of
yes.
information gap there. How do you think Nigeria can close it? Because you said we came late to the conversation.
Yes, there's a lot of information gap in GMOs at the moment, and that's why there's a lot of alarm on social media. A lot of people are attributing anything they see now to be GMOs. Once the fruit is very big, they say it's GMO. You know, somebody, in fact, somebody actually said up to tin tomatoes, everything tinned, everything canned is GMO. A lot of speculations are out there. People are frightened because nobody wants to fall sick. Nobody enjoys the pains of sickness, and everybody wants to stay healthy. So, in the course of that, first of all, you are right about the fact that there's been very little information out there. Many Nigerians did not know that there were GMOs in Nigeria. That's one of the saddest things to think of when you approach these conversations. Many Nigerians were not aware. Many of them were not even aware that Nigeria had signed into law the NBMA Act. They didn't even know. Many of them are blaming this administration. They are blaming the President Tinubu-led administration and, taking up vituperation again. But actually, GMOs were signed in as far back as 2015 under the President Goodluck Ebele Jonathan's era. That's when it was signed into law. Many people were not aware. Many Nigerians didn't even know NBMA up until today. I dare to say that even yourself, your esteemed self, may just have been finding out about NBMA just recently. Many Nigerians did not know that there was actually a biosafety management agency. The agency rarely comes on social media to give us information. The agency very rarely gets involved in conversations. Many Nigerians only knew NAFDAC. Everybody knew NAFDAC as the Agency for Food and Drug Control. But Nigerians didn't know that somebody else had taken the stamp from NAFDAC and was responsible for stamping, GMOs into the country. So it's a conversation that will be sustained for a while because now Nigerians are gradually figuring out what has been going on for years because there is politics in GMO. If you look at how GMOs were approved into Nigeria, it was approved, or the first GMO was approved on May 1st, 2016. May 1st, 2016 was a Sunday. May 1st, 2016 was a public holiday. How is it that a federal government staff, the then DG of NBMA, was able to stamp and approve on a weekend, Sunday, on a public holiday, GMOs into the country? So it's a growing conversation, and I think that we should sit back and enjoy the ride because it's going to be interesting. There'll be a lot of unraveling. There'll be a lot of, people can call it what they want. How do you explain that the deputy director of Nigeria's Biotechnology Research and Development Agency, which is like the main people spearheading GMO in Nigeria, how do you explain that the deputy director of that organization, who also doubles as the head of agricultural biotechnology in the Ministry of Science and Technology, doubles as the country director for the Open Forum of Agricultural Biotechnology, OFAB? OFAB Nigeria is an organization that is heavily funded by the AATF, which is funded by Bill Gates. OFAB is a project that has been set up to ensure that biotechnology is adopted across Africa. And the country director of that organization becomes a federal government staff. and pushes GMO and is even credited as being, quote unquote, the priestess of GMO in Nigeria. I think that's another developing conversation. There's a lot of interesting angles to this thing.
That's right.
How would you explain somebody
That is
who
conflict
a
of
country
interest,
director
isn't
for a
it?
foreign
That
organization?
is conflict of
Yes.
interest.
Yes. So and you see, food is something that even if we get it wrong in other areas of governance, if we get it wrong in many other areas of the society, you cannot afford to get it wrong in food, because you cannot do without food. There are many people that may not go to the hospital, but they will always eat food. So we cannot, if there is a time that everybody's patriotism has to come to the fore, it is now, because we cannot afford to get it wrong with our food. If we have gotten it wrong, it is time for us to backtrack before the damage becomes severe and we cannot recover from it. Because one of the things that we expected our regulators to do is to study the imperatives in other countries. I have a book here, which I can even bring out. I have a book that shows, it was published by our center, that shows many countries that banned GMOs and why they banned the GMOs. Just give me a moment. Let me see if I can pull it up and read some of it to you.
Yeah, we're basically out of time.
Okay.
Yeah.
Can I just read just a few?
Okay.
You have Angola.
You can just read a line.
Angola banned it. You have Algeria. Algeria banned it. Austria banned. Australia banned. Australia approved for cultivation in only one minor island called the Kangaroo Island. Azerbaijan also banned it, and they banned it based on the Cartagena Protocol, which Nigeria is also a signatory to. The Cartagena Protocol it basically has a principle called the precautionary principle in it that says, I'm paraphrasing now, that if the risks outweighs the gains, or it's going to affect your biodiversity, or it's going to be controversial, discard it. And many of these countries banned it because of the Cartagena Protocol, which even Nigeria is a signatory to it. And in fact, one of the people that negotiated Africa's position or negotiated that precautionary principle is a Nigerian, Professor Johnson Ekpere, who is currently the head of the Anti-GMO Alliance in Nigeria. So what are we saying? There's a lot of, and like I said, Nigerians joined this conversation late, but it's not late enough, because we now need to
really have to go
take
now.
it very seriously. Thank you.
Thank you so much, Dr. Segun Adebayo. I will get you on another program where we'll have longer time, because there are many things to unpack, especially now you mentioned the Cartagena Protocol. Dr. Segun Adebayo is the Executive Director, Center for Africa Policy Research and Advisory, and Deputy Director, Center for Food Safety and Agricultural Research. Thank you for your perspectives on the news today. Thank you.